Dr. John, you're my medicine man. Yep, Dr. John, I became her medicine man. Her name was Mary Ann. She comes into my office for the first time. She says, Doctor, I'm here for my medications. Before I even had a chance to say a word. So I said to her, maybe we could talk a little bit, get to know you a little. She says, what's there to talk about? I'm here for my Prozac. I know what I take. My Prozac for my depression, my Xanax for my anxiety, my Zoloft for my trauma, my lithium for my bipolar, my Seroquel for my obsessive thoughts, my Trazodone and melatonin for my sleep, my Adderall for my focus, and my Haldol for voices. Those meds, that's what I need. I counted them. 9 psychiatric medications. I thought to myself, this is ridiculous. She said, I'm just here. I'm here because my previous psychiatrist retired. I've been on these for years. They work. Please, let's just continue. We don't need to talk about anything. Mary Ann. I've learned a few things in the world of psychiatry. There's a few conditions that I do think medication is necessary the vast majority of the times. But certainly I'm a big believer that medication is not always necessary. Certainly 9 medications, 9 psychiatric medications, I doubt that they are truly necessary. But in the world of psychiatry, we have learned here that there are certain medications which are necessary, certain conditions which we would classify as being medical, just like diabetes, medical. Yes, you can work all you want on good sleep, on good appetite, on exercise, on spirituality, but in the end, if you truly have diabetes, you probably need some kind of medication. The same thing holds true for certain psychiatric conditions, which I've learned and seen over time. Schizophrenia, for example. People with schizophrenia almost always need some type of medication to help them. They're hearing voices, having paranoid delusions, and the medication can decrease the intensity of these incredibly suffering psychotic symptoms. Bipolar disorder, most of the time, somebody who really has had a significant manic episode, they do need medication. It can make a world of difference. It can be life-saving. And lithium, indeed, is the gold standard. Severe depression, what I would call a biological depression. Again, medication, usually a serotonin kind of antidepressant like Prozac, can make a world of difference and indeed can save lives. Obsessive compulsive disorder, not just somebody who's sort of perfectionistic, but somebody who really, most of their day is consumed with these thoughts, intrusive thoughts in their head, or compulsive actions. They keep checking things again and again, and it affects their ability to work. Panic attacks. I can't tell you the number of people who come to my office. They've tried all sorts of therapy strategies and techniques, but they still suffer from panic attacks. These are some of the conditions which I've learned over time where medication can make a world of difference. Dr. John, you're my medicine man. But I basically try my very best, and I wish a lot more psychiatrists would try, to not jump towards medication. A careful evaluation needs to be done, and other things need to be tried. But if somebody's truly suffering from these, what I just listed off as what I consider medical psychiatric conditions, then medication is almost always necessary and can make a world of difference. As for Mary Ann with her 9 medications, well, she is like many patients who come into my office. They want everything to be ordered. They look at life as sort of compartmentalized, as if life itself could be reduced to a diagnosis and then be saved through swallowing a pill. Unfortunately, many of these people are missing the boat, and therefore they're depriving themselves of really looking at themselves in a deeper way and connecting and making their life better in all sorts of magnificent ways. Again, through spirituality, through exercise, through mindfulness, through taking the time to explore themselves. It may be a difficult journey, but it can make all the difference. As for Mary Ann, well, she came to me for years, every month, like clockwork. She never missed an appointment, and she always insisted on staying with her medications. I tried. I did get to know her a little bit. I found out that she had been abandoned when she was very young. She had gone from foster home to foster home. She'd had a very, very difficult youth, but she wasn't really to look at it, to look at the trauma of her past. She just wanted her medications. She came into my office with her coat on, would not take it off, and she would talk about medications, make sure that everything is straight, and then she would leave. She didn't want anything more. As for me, what can I say? I basically became her enabler. I was sort of like a robot giving her medication. I tried, but then I realized that for Marianne, this is what worked. Even though I didn't agree with it, inside her world, this is what worked. She wanted these medications, these 9 medications. She continued on them, and for her, she was, in a strange way, happy with her lot. Marianne, never coming out of her comfort zone. Perhaps a lot like us.